So I spent about 10 years of my life going back and forth between Atlanta, Georgia CDC and Washington, D.C. And much of the time I would end up in the Humphrey Building, Health and Human Services Building, and thought, wow, this is the home for all of the health work in the United States. This is where, in one way or another, 19% of the GDP of the United States, we spend it on health. And it was shocking just how many different parts there were to this enormous department, food and drug and disease control and health services and the rest. And if you went out the front door and you walked down the mall, you went by the Department of Transportation. Oh, that's a health agency. Leading cause of death from ages 3 to 34 is car crashes, and a third of all of our air pollution in much of the country is related to transportation. A little further down, you pass the Department of Education. Well, having good genes and having good food counts, but one of the best predictors of how long somebody's going to live and how healthy they are is how well educated you are. And I get further down and you get to the Department of Energy. And when I was young, I thought the Department of Energy was about energy efficiency and insulation and making things better. And finally got to the Department of Agriculture, and that was one of the most important health agencies of them all. And across the way was the Treasury that was supposed to be integrating all of that. And you'd walk back, and finally, to relieve yourself, you'd go to the Botanical Garden and realize, it's really about human well-being and mental health. So I put this rather elaborate slide because, in a way, it tells you the story of energy in the United States. You can see that solar is that tiny yellow line at almost 2%, 0.2%, 0.02% of all the energy used in the United States. And petroleum, at least at the time Lawrence Livermore Lab pulled this together, was the major energy source. At this point, in fact, major energy source in the United States is natural gas. It's now exceeded coal. And if you look at the liquids coming out of some of the natural gas wells, it is even a larger amount. Nuclear goes up relatively, and renewable energy is starting to tip up since about 2002 or 3. One of the things that struck me about this meeting, Lynn, and I thank you for organizing this and the folks at the Academy, is I had no concept of just how vast some of these numbers are. This is such an immense undertaking that we're looking at. And this is monthly use of energy in the United States, quadrillion BTUs, about 70 to 75 BTUs. What's fascinating about this is our monthly consumption in the U.S. is pretty much the same as it was in 1975. We've added 100 million people. So efficiency really has been extremely important in all of this. The President's been committed, and this is from one of his energy reports, to increase in renewable energy, and it's pretty impressive, from 72 terawatt hours to 174 over the course of about 4.5, 5 years. So we're moving in the right direction, but I would say this health chart has some disappointing information in it. Now, I have many friends in the research enterprise, the health research enterprise, and I'm sort of there myself, and look how well the big blue blocks have done for research over time. From the 70s to now, health research dollars have been quite substantial. I know they're decreasing now, but look at the green blocks. And one of my big points here is, I think those green blocks, those energy blocks, are health blocks as well. And if we've learned anything from the last 2 days, is that these energy decisions, biofuels or whatever, are health decisions. And I would argue that our starving the energy research enterprise, we are now reaping the impacts. Boeing is reaping the impact of not having decent batteries on their Dreamliners. I shouldn't say, I don't know the impact, but to have an entire fleet of huge aircraft grounded because of not having batteries that work extraordinarily well is a concern. I'll come back to this. And natural resources, I would argue, has nowhere near been benefited. I made this sort of odd comment about the Department of Energy, and I don't know, I somehow thought that their research would go to things that made our lives better, and I suppose national nuclear security is important, but to have 37% of the entire DOE budget going to nuclear security and only 8% of energy efficiency and renewable comes right back to this, and health people ought to be receiving research from there. What I was struck by in this report for the last 2 days is I don't think we've ever done an adequate environmental impact assessment on biofuels. And I've probably read 100 environmental impact assessments, and my God, they're such exciting reading. You know, Lynn and I just looked at one with 84,000 public comments. I'm not exaggerating. And what I have found in my past experience is you'll look through thousands of pages, and the last 3 pages will be about health, and it will say, no air pollution standards, no water pollution standards will be violated, no noise will really disturb the neighbors, at least not more than a couple of days. And we don't adequately capture health in the environmental impact assessment process, even though it's required under the National Environmental Policy Act that Dr. Goldstein just referred to. And I had the chance of serving on an Academy committee with Dinah Baird. Dinah was in the Council of Environmental Quality in the White House, a very experienced lawyer, 25 years experience looking at the National Environmental Policy Act. And she repeatedly kept saying to us when we said, we want health impact assessment done, she said, no, we already require health impact assessment in the Environmental Policy Act. We just have not done it. So think about environmental impacts. Here's nutrients, nitrogen loaded on the United States. Similar slides were shown during the talks over the last couple of days. When we allowed biofuels and we pushed this, did we do an environmental impact assessment of what would happen if every child in the Midwestern United States was drinking nitrates in their water, or for that matter, drinking atrazine or alachlor or glyphosate Roundup in their drinking water? Do we look at what would happen if atrazine went down the Mississippi, and it does go down the Mississippi, about 70 million pounds of atrazine are used on corn in the United States. It impacts some of the organisms at the very bottom of the food chain, the tiny rotifers that are creatures in the Gulf of Mexico, for example, depend on further up the food chain. 7,000 square miles of the Gulf of Mexico. The last meeting our committee held, our group held, workshop held, was on the importance of food, farm fish in our diet, and yet 7,000 miles of the Gulf of Mexico, wonderful fish resources lost because we're growing corn to make fuels. If you get a chance, take a look at this marvelous book by David Lichtwager. It's Portraits of Biodiversity, and he goes around the world and he takes pictures of how much biodiversity is in 1 cubic foot in various places around the planet, and this is one of the most striking ones. It's not as striking as Costa Rica, where many more organisms are on a cubic foot that he's photographing. This is Cape Town. You can see the various organisms in a meadow in Cape Town, South Africa. And there's a cubic foot in a United States cornfield. Now, when you think about it, maybe that has long-term, not just environmental, but health impacts. So I was lucky enough to be asked to serve on National Academy of Sciences Committee, Board of Environmental Science and Toxicology, to improve the health in the United States, the role of health impact assessment. And the report came out in late 2011, and we had a mix of public health people, also economists, international folks with a lot of experience, toxicologists, and others. And as everyone in this room knows, we had a number of things that we found. Health happens more than just in the doctor's office. It is affected by everything where we are, where we were born, grow, live, and age. And housing policies, urban planning policies are health policies, and that we ought to be looking in a systematic way when we make these big decisions, big plans, policies, and programs about how they're going to impact health. We came up with something called Health Impact Assessment. You can go to the HIA report and pull it down online for free. a systematic process to capture the data to look at this on the health of the population and a distribution of those effects, and makes recommendations for monitoring and managing. There's something, Bernie, I don't know if I'm right about this, but I think this is quite different from risk assessment. It not only captures the adverse effects, but it captures the beneficial effects. There are beneficial effects to having 40 people have a job year-round in a ethanol production plant. There are beneficial effects to many of the changes that occur in these communities. There are negative effects or boom-bust cycles, these larger social cycles that happen when production like hydrofracking is put in place. And it also looks at various types of evidence. It's not just toxicologic evidence, it's other kinds. And this is really different. This is really different from how we've done risk assessment. It calls for engaging stakeholders early and through the process, not waiting until you're finished. It ought to focus on things that are important. Don't spend a lot of time doing risk assessment or health impact assessment on things that don't really matter. Worry about the big issues that affect people's health. I've already talked about the stakeholders. I'm going to, and I won't tell you the steps of an HIA, except these last two. Monitor what happens. So we've made this experiment of biofuels. Maybe we should be tracking from a health standpoint as well as just an environmental and life cycle standpoint what's going on, evaluate it, and make recommendations. Be careful about quantitative estimates. That was one of the conclusions. Numbers are helpful. They're a real crutch, but just because you measure it doesn't mean it's important, and just because you can't measure it doesn't mean it's unimportant. I'm going to skip this because I'm running out of time. I want to come back to this as my closing slide. I do think that we in the health world need to be touching on these energy decisions much more profoundly. It is in the forefront of health in the United States going forward. I think we desperately need more research in the energy world, and we need more research that touches on both health and energy. So with that, thank you very much.